Uh, is it visible, Dr. Shobha ma'am?
Yes, Latha.
Are the slides visible?
Yes, yes.
Thank you.
And you can make it full screen. Latha, you can make it full screen.
She's telling to make it full screen.
Hello, Latha. Can you hear me?
Yeah, I can hear you. You can hear me?
Yes, yes, yes. Things are quite clear.
It's audible clear, no?
Yes. Are you ready? Shall we start? Latha, please unmute yourself.
I should keep on mute till you finish, no?
Yeah. Shall we start? Are you ready? So, I think Dr. Latha is ready now. So, hello friends. Good evening to one and all present here in this today's webinar. I welcome you all on behalf of the IJH Homoeopathic Journal India Foundation. Today we have a wonderful webinar by none other than Dr. Latha Devarajan. She is a very senior practitioner practicing homeopathy since almost 30 years, and she's a very mild and a humble person, at the same time very scholar. So we will get to learn a very nice, and her topic is also fantastic, like the concept of posology in homeopathic practice. So as we all know, friends, that in every seminar or webinar or every lecture of homeopathy, we all are eager to understand and know that what potency the doctor, the prescriber has given, how frequently he has repeated. So Dr. Latha is going to tell us more on to this. Dr. Latha is academic and research coordinator in Dr. M.L. Dhawale's institute at Bangalore. She is also a research fellow Ayush for EMR project on learning difficulties, and she is a writer, practitioner, speaker, and a researcher. So let us learn a lot about the posology and about the homeopathy from Dr. Latha. Yes, Dr. Latha, I welcome you. The stage is yours. Please unmute yourself. Latha, please unmute yourself. Latha. Yes,
Thank you
Latha.
so much, Dr. Shobha ma'am, for the introduction. Deeply grateful to our Vishpala ma'am and the HGIF faculty and the editorial board for giving us an opportunity to share and learn from each other. My topic on posology is a little bit vast, but I'll try to complete it as much as possible in the given time. So most of the concepts come from the cases that we have treated in relevance to the masters, and some of I will share it as the case presentation carries on. How do I change the slide?
Click on the slide and then go to the
Okay.
down.
So the posology is actually, we refer to the study and determination of an appropriate dose or potency of a remedy. And invariably, it is also the frequency that we administer. And it is almost every time case specific, individual specific. And the whole concept of potency got evolved by our masters when they found problems in their cases. That's an interesting study because almost all of them experienced aggravations, not getting cured. What to do? Are we using the right potency, even though the remedy came across right? So we found a range of potencies getting evolved from physiological to dynamized, and later on, Hahnemann introduced the 50 millisimal and the plusing potencies. So we have this range of potencies available to us. Decimal, centesimal, and millisimal is what we are all practicing with. In order to understand posology, the first concept that we need to identify is susceptibility. Because without susceptibility, we'll never be able to understand what is the potency choice we have to use or the repetition. So susceptibility, all of us know, is the inherent capacity of an individual to respond to a stimuli. And the right prescription with right timing will ensure that the suspended state of influx in the disease is going to get removed. Most of these studies were carried out by Hahnemann, and it is listed in 31-32 aphorisms as well as in Ken chapter 14. For me in this presentation, what I'm going to focus on is the coordinates of susceptibility. That is the reactivity, the sensitivity, the immunity, vitality, phase of illness, and degree of correspondence, which MLD Davle sir put together to understand the structure that he drew to understand susceptibility. So the presentation is divided into 4 parts. The first part is the reactivity, how it impacts our posology. Then is the sensitivity. Then how suppressions make an impact on posology. And finally, the whole cluster of immunity, vitality, stage of disease, and correspondence of remedy. So let me begin with the first part, the coordinate of reactivity to assess posology. So reactivity is usually understood as an organism's ability to react to a stimulus. How will we know it's reacting to a stimulus? Signs and symptoms are the first form of reactivity. And what the patient is sharing gives us the signs and symptoms, and what the physician is judging and observing. So let me begin with the first. There will be 4 cases that are shared. The first and second case will share with you the cluster of characteristics in a functional illness. Case 3 will be the structure and pathology coming in, but yet it is reversible. And case 4 will be an advancing pathology which is irreversible. So let me begin with case 1. So this is a female, 28 years lawyer in a private firm, estranged from her husband. What happens is, on the first night when the husband was drunk and all that he demanded was money to pay back his loans, hit her violently. In a state of fear, she went back the next day to her parents' home. But the mother-in-law husband continued to stalk her in a hope that she comes back because she's a lawyer and they expected her that she's going to fund them. What happened in this state of shock was, within a month, there were symptoms of anxiety, restlessness, sleep disturb, sudden cessation of menses, dreams of being chased and not able to go to work. It is called an adjustment disorder with secondary amenorrhea, the diagnosis. So understanding the clinical diagnosis gives an awareness of what exactly we are treating. So usually this condition is not going to last more than 6 months on its own. But right now, patient has become dysfunctional, not going to work. So, and these are the cluster of extreme characteristic symptoms. Let's repetize and see when we go through this cluster of cognition, affect, and behavior and conation, that is emotion, intellect, and behavior. You find anxiety with restlessness and being chased and having faces seeing around, especially the mother-in-law husband. Even if they are not there, she sees them. Poor concentration, inability to work, and ailments from shock and grief. It's a functional phase. We need a acute or a deep acting that covers this entire cluster of symptoms. So when we repertorize the case, Simisifuga, Aconite, Kalika, Kofia, and Naxwamika came up. Seeing the acuteness of the case and the symptoms, Aconite came up. What is interesting is, how did we choose the potency? The reactivity is very high. You're getting very characteristic symptoms. Sleeplessness, anxiety with restlessness, and anxiety with palpitation, as well as she's having this imagination of seeing faces and then ailments from intense fear and shock. So there are enough characteristics to call the susceptibility high. That is the reactivity of the individual. Limited changes are the tissue, functional changes. So we went with aconite 1M, high potency, infrequent, single dose. Is there any other in the chat box? Any other remedies that you all would like, or can I go ahead?
Nothing yet. I think you can go ahead.
So after this, what happened was within a month, within the next day, she got her periods. That 1M1 dose was enough to recover the susceptibility. She settled, went back to her workspace, and got the divorce that she wanted. Now take another case. A 9th month baby. The mother hears the news of the husband's extramarital affair in the 9th month, experiences intense grief and shock, becomes drowsy, stops eating, develops contraction but does not cooperate in labor, was taken to for a C-section. Mother was drowsy. There's no interaction with the baby. Baby is healthy, silent, but does not cry, has a dull and vacant look, and does not take feeds. So the remedy chosen was opium based on this dull, drowsy state of the mother. Mother was given 1 dose of opium. And when the mother recovered in the state of grief and shock, with the dose of opium, she started taking the baby and feeding the baby, and the baby came back to normal. So this is the case that shares again how the reactivity is high at the level of mentals under an intense grief, which is resulting in a dysthymia-like condition. It is functional and not progressive. Now let's go to a little more deeper case. The case 3 is a case of PCOD. That means this is a condition that is going to have alterations in the PNE and FGUT axis. Now the disease is going from superficial functional changes to structural changes. So this case was about a girl in her 12th grade who's studying for the IIT exams. She's not able to cope with the IIT classes or with her school. Having a patient who was a topper till she joined the IIT classes in her school, suddenly she started losing her ranks. She became extremely anxious, tired, and depressed. So, what is the cause for this? If you understand this child, she was intensely attached to the brother who was a naturally born IIT scholar who did extremely well and who was guiding her. 1 year back, he got into Bombay IIT and goes there, and she was in Bangalore. And she's brought up in a very pampered nuclear setup. Her only reason for doing IIT is the attachment with the brother and with the hope that she will also go to Bombay IIT. And that was her dream, that she wants to be with the brother and she wants to emulate the brother, irrespective of whether she has these strengths and capacities or resources. It generates an intense state of anxiety, an anxiety which was always there from beginning, but now it has got heightened. Especially before exam, she will not eat The person with whom she fights the most is her mother. The mother has always been at the receiving end of her screamings and shoutings because she just cannot cope with what's going around. What are the remedies that are coming? Anybody in the group? Shobha, you can just, ma'am, you can just share with me what are the remedies coming.
Uh, Nobody has still written anything.
Okay,
Uh,
so we go ahead. So these are the
one,
physicals that we have, aggravations before menses, dreams of missing exams and night. Can you see here, there is a very qualified mental state that is evolving of a heightened anxiety. There is a personality also which is anticipatory, anxious and attached and irritable. And there is an ailments from anxiety about performance. So when you repertorize this case, these were the remedies that came up. Kalika was chosen as the deep acting constitution. So we find that most of the characteristics are at the level of mental generals and physical generals. See here, you do not get any characteristics at the level of LSMC. That means the characteristics at the level of disease is still not evolved. So you have characteristics at one level and a pathology that's evolving. So you find the susceptibility, which was high in a case like aconite and opium, is now coming to a moderate level because the characteristics are not available to us at the level of the disease. So tissue changes are present. Hence, we go with a medium potency and we have to repeat the dosage. May not be weekly or daily, but at least once a week in 200 potency till she stabilizes with her periods. Now, that's exactly what happened. The PCOD normalized within the period of 6 months. After 3 months, again, she had a bout whether I should do IIT or I should focus on CET. But then she stabilized over there and decided to withdraw from the IIT classes and focus on the school. After 8 months, when everything had stabilized, mind and the menses, she again developed a little bit of an anxiety. Can I cope with my school performance? I've not done well so far. This is the time for us to increase the potency to 1M. I will explain why we do this change of potency. And the periods got normalized. And this was the scan report before treatment and after 9 months of treatment. You find that the PCOD has cleared. There is a, now we go to the fourth case. I will come back and explain the concepts behind the repetition and choose of potency again. Case 4 comes with to me in a stage 4 of squamous cell carcinoma, which has of the buccal mucosa, left side, and it is around this region, lower wisdom tooth. Around this region, he develops the cancerous lesion and he was asymptomatic for some time and then it became extremely severe since the last 1 or 2 months. He has opted out of conventional therapy due to his age. He does not want to go through that. His vitals were stable, but weight has come down 10 kgs in 9 months. He's having only liquid diet on this side because this side is very painful. And the symptoms that we got were offensiveness, unable to open the mouth, bleeding was continuously happening from this lesion, and there was no hope of recovery. So you find now, can you identify? There are symptoms coming up. There are few characteristics at the level, one characteristic at the level of mind. This is a very fast advancing pathology. We do not have much time for this patient because he's reached stage 4 of his illness and he has these a few characteristics at the level of his disease symptoms. So we cannot choose a potency which is very high, which will aggravate, nor the moderate, but in the moderate zone, we can choose a potency like 30 that will also cover this part of his reactivity and the advancing pathology. Most cases of cancer we find respond well to 30 as well as to the millisimal scale because we are able to repeat it. On repetization, these were the remedies that came up, and nitric acid covered almost all the symptoms, including his present mental state, and it is listed very high in repertory also for cancer, oral cancer. So you find that 30 frequency comes in the reactivity, a moderate sensitivity, there's no evidence of suppression, there's a structural advancing pathology of stage 4. There is a vitality which is going down, but it is stable, not fully gone down. The BP and pulse is still stable. So we gave him nitric acid 30 TDS. He's still on treatment. He has not yet sunk completely. He's much better with the pain and offensiveness. He's still having liquid diets only, but he's able to manage. The allopathic physician has said that he may have a year or a little more than a year to pull through with this illness. So I am right now, I've just kept him on this medicine for his and suffering to come down. And definitely the mental state also improve. So what did we find? There were functional reversible illnesses with high characteristics requiring 1M. There was a structural reversible case in Kalikab requiring moderate susceptibility, 200 frequent till recovery. And in a case of advancing pathology of cancer, 30 in frequent doses till we keep him without symptoms. So we come back to understanding from where did we source all this information? Where did we learn our topic of posology? So drugs are capable of influencing organisms. Kent was the one who highlighted the maximum on potency. But there are certain things to remember with Kent. Kent conceptualized how drugs influence internal mental processes. He advocated use of constitutional drugs in good susceptibility cases, and he believed that we should increase the potency. Like when 200 stopped acting in that Kali Cup case, you go to the 1M because primarily it was a case which was functional and focusing on an integrated mental process. The drug becomes a remedy when it matches the potency, frequency, and effects cured. Now, let us also understand what Jar had to say. He says when the symptoms are very clear, positive, and you get very peculiar symptoms, it means the higher potencies are required. He also says that when symptoms are not very clear or there is an advancing pathology, please consider lower potencies. Stuart Close modified it by saying that you need clearer, positive, finer. It was just his language that he used to say that more peculiar, more characteristic symptom in a well taken case, higher the degree of susceptibility and higher the potency. What we need to be cautious here, yet the concept of seat of disease, location, pathology was still not evolved at this time. So that got introduced later when Boga Boning Hussain started improvising on Kent and started understanding how pathology also makes an impact on potency selections. Next, we take the second coordinate of susceptibility. The second coordinate of susceptibility is the sensitivity. Now, what is sensitivity? A very interesting topic. Uh, it is usually the reactivity of the mind and body, and it is sensitivity is usually described as how we receive and react to pain at the level of mind and nerves. So, how do we come to know how we are reacting at the level of our mind and nerves? Again, by our signs and symptoms. The intensity of our mental state, expressions, attribute, and symptoms, the physical general characteristics, and the examination findings will give you the state of sensitivity. And this sensitivity, as the second coordinate in assessing susceptibility, will decide what should be your posology like. Now we take a case to understand sensitivity. This is a patient who has come with a diagnosis of perianal abscess. The only symptom right now we have is a discharging abscess. See there, see the what is mentioned here, 4.5 by 1.5 by 2.5 centimeters. There is no other except a collapsed abscess which is not healing. This is the third time she's getting in the matter of 2 years. This time also she has taken other mode of treatment in the last 1 month, but she does not want to go for surgery. Now, what does this case indicate? There's something that is blocking the healing of this abscess, and we need to understand that. Now, let's examine her. A lady, masters in fix, came during the COVID time, 2020-21. Here, she wanted to complete her MSc. She joined MSc. She was at home looking after the kids because everybody was at home during COVID. She neither could manage the kids who were extremely naughty for a mother who's so rigid and perfectionist. She couldn't have them running all around and messing the place up or watching TV when she would have wanted them to study, or a mother in law who kept taunting her about the way she brought up the children. She became extremely irritable, sensitive to the criticism of the mother in law because she was not used to this pattern of staying at home and doing this, and so used to going out, having one structured lifestyle. COVID changed all that for her. And then you find characteristic physical genders coming up. These are the past history and family history. On repetizing this case, silica came up. Now, silica also covers the rigid, perfectionist, chilly patient with an unhealing abscess and who is more focused on the work area, very fastidious, but at the same time very sensitive and very vulnerable to criticism. And when things do not go in her way, she develops anxiety. So silica was started in the 200 potency when that scan report was shown to us because it was a very big abscess. After 7 days, this became the size of the abscess. Now what happens? 200 has held the case so far, but it is not completely healing. You have used it for 7 days now. So, Davli, I would like to put forward one structure to you where you will analyze every time because just like life is dynamic, susceptibility is dynamic, posology is also dynamic. It does not stay the same, it moves from time to time. So, at every point, you need to put this structure so that you can assess what you're treating. So, sir put this table up that described first assess the characteristics. Now, what the stage we are in, there are characteristics not more at the level of mind. There is suppression at the level of emotions, but there is a high correspondence to your remedy silica at the level of predisposition, disposition, expression, and pathology. There is a functional headache symptom. There is a perianal abscess which is not healing. A vitality which is fair and up to now has responded to 200. Hence, we try the next potency 1M in infrequent doses. Now, see what happens with 1M. There's a complete healing of that area. So you find that we need higher potencies to completely heal her internal struggles of the mind as well as the non-healing abscess. So where did this concept come from? Mostly Hahnemann and Kent were the ones who spoke about frequent potencies. High potencies are adapted to nervous, intelligent and intellectual people, where Hahnemann found the people who are sluggish, with poor sedentary habits, and who do not have this refinedness respond to lower potency. He also felt that when you're under the influence of tobacco and alcohol and all, you tend to go into lower potencies. So what do we conclude? When you have high level of sensitivity at the level of mind that's available to you at the level of attribute and expression, you need higher potencies in frequent repetitions. If it is not very high reactivity, it will be moderate. How do our masters Kent approach this? What he says, Kent was very clear that one potency will hold for a patient only for some period of time because the susceptibility to subsequent administration of the potency will continuously keep falling. As a result, he introduced the concept of multiple potencies to be used, and even Hahnemann too was of the opinion that the potency must always go higher compared to the previous one. So what Kent called this was the octave potencies. He would not favor using the same potency for a very long time. And also remember, Kent increasing potency was also because of his strength, which lies in abstracting mental characteristic. Again, review this, which we will come again in our later presentation. Please review this in light of the pathology and the diagnosis. So, according to Kent, in acute diseases, repeat the potency every 8 hours or even 4 hours, sometimes even every 5 minutes. And when it comes to constitutional prescriptions, he would like to go to 30, 200, 1M, 10M, 50M, depending on the response, because he feels each potency will hold only for a certain period of time. Now we come to the third coordinate of susceptibility. This includes a cluster of immunity, suppressions, general vitality, state of pathology, and correspondingly, what remedies are we going to use to take care of this? So as you see, the first part focused on more of functional changes which are reversible. And there was one case of squamous cell carcinoma that we are still maintaining with an advancing pathology. But that is not the only type of susceptibilities we face. We are going to face challenges when we have altered immunity, when we have cases of suppressions, when the vitality keeps sinking, or we require to constantly evaluate our strategies when the pathology keeps advancing. And we also need to pay what is the kind of remedy forces that I'm going to be using under these conditions will also decide my potency and frequency. Okay, so we are now going into the second realm beyond what Kent and Hahnemann spoke of highly crystallized mental states. But now they also remember, Hahnemann also started understanding in pathological cases, our master figured out he wasn't getting the responses as quickly. So let us understand what are the difficulties we face in these coordinates and how to solve it. Now let's go to the first part is immunity. Now all of us know immunities can be altered. Immunities can be aberrant. Immunities can be autoimmune. So all when immunity in our body shows these kind of responses, it will directly impact the posology, the potency and the frequency and the kind of remedies that you're using. So let me explain one case of immunity, which was a case of ulcerative colitis to demonstrate what is the potency that we will be using when we come across an autoimmune deep-seated illness that is also causing a lot of other difficulties. Now, this is a patient who's just 28 years. He comes with bloody diarrhea. He has a lot of pain in abdomens. And can you see this? There is a weight loss of 5 kgs in 1 month. He's been having this complaint in the mild to moderate zones over 2 years. But there is a sudden dip which is happening now. And from a disease that was in the mild has gone to a severe chronic ulcerative colitis with extreme degree of weight loss and suffering. And also it's like an inflammatory process that has suddenly flared up. You find an ESR which is 77, a CRP which is raised, and a hemoglobin also which is dropping. So what do we do? In such cases, we will have to define the chronic case first. So what happens here? Patient is very attached to his family. What happened 2 years back? The family was deciding to split the house and the business. There are three brothers in this family. And the eldest brother chose that now that all of us are married, all of us need to, take care of our own work, our own family. And he did not think that it's going to come so soon. He thought they were just talking, but 2 months back, it all came on paper and it was made legal that definitely they're going to put this into action. What was initially an anticipation whether this is going to happen or no, now has come down with a problem that he does not know. His sensitivity is not able to accept how his parents are going to cope with this. How are the children in this house? Each of them have two kids. He's so attached to all six of them. He does not know what's going to happen if they all separate. And he's worried that what such a small business we run of trading, how are we three going to split it and how is it going to be enough for the future of the children? Can you see how much he's worried and caring about everything related to the family and thinking, exerting his mind on this is aggravating his complaints. He also has fears of being alone. Any remedy choices? Keeping in mind also he has frequent bowels and a state of sleeplessness, which is evolving since the last 2 years, but has become worse in the 1 month. Has any responses come, Shobha?
Yet, maybe you
Has
want
any
to wait.
responses come?
Not yet. Do you want to wait for a minute?
Yeah, we
Calcarea
can
for
wait. Just ask them what is the potency
yeah,
they
yeah.
would like to use and which remedy.
Yeah, the remedies which are coming up now are Calcarea fos, Bryonia, Kalika, Nux vomica. The potency is 200, which is suggested. Again, Kalika, Kali fos.
Very good. I think this was a similar set of remedies that we thought of. And any other potency choices are coming, Shobha?
Calcarea carb, Kalika 200.
Potency choice.
200, 200.
200. So now remember when I shared with you, there is an in characteristic symptoms available to you at the level of mind and body, but just look at the diagnosis. What is the diagnosis telling you? This is no longer in the mild and moderate ulcerative colitis. This has become extremely severe in the last 1 month. There is a
Dr.
weight loss. Huh?
Vimal is suggesting 30.
I can't hear you, Shubha ma'am.
Dr. Vimal is suggesting 30. Potency
30,
30.
yes. So you would like to go with the cancer case, how we thought of cancer case 30, you would like to go with that analysis of susceptibility and think here. But remember, the cancer case had very few characteristics at the level of mind and an advancing pathology that made us safe to go with 30. Here you find an intense sensitivity of the mind, and correspondingly, there is an extreme advancing of the pathology which has become a severe zone. Can you see the dichotomy that is developing here?
Yes, Latha, there are other potencies coming up is 1M, LM, Nux vomica 1M, pathology being deep
Very good,
seated.
because this is what we do. Because if we do not subject our analysis of posology into that box that I explained to you, you will start with 30, go to 200, 1M, and then come to LM. And you would have actually missed the cure of the case, because this is what even I do. If we do not subject ourselves to the analysis, we tend to make a mistake. You have a cluster of symptoms of the mind, which are very sensitive, and you have a pathology which is very advancing. And this was a challenge that even Hahnemann faced. And please, I would like to revise with you that this ulcerative colitis is an extremely difficult disease to treat when it becomes severe and chronic. It becomes that your defense systems are breaking down, you're developing ulcers in your intestine, you're having systemic complications setting in. It's not so simple at all. Very soon, the vitality is also going to sink. This was the repetization that we took up. Califos was the first remedy based on his cares, worries, anticipation about the business, about the family, what's going to happen to their future. In a soft, sensitive, attached, kind person with lean, thin, very fair, and so much full of cares and worries, Califos was chosen. Interestingly, if you read Califos' bowels, it covers quite well this ulcerative colitis symptoms, and it is highly tubercular also. So this was the reason for choosing Califos, and it also has sleeplessness from anxiety and strongly tubercular. What is important is, what do we understand of this immunity? This is a compromised immune mechanism that's taking place, indicative of a lower susceptibility. Now is the time for us to put up the box and analyze the patient. The reactivity at the level of tissues is showing you only disease symptoms. The stage of the disease is chronic. Stage of pathology, sorry, is not in remission. It is advancing rapidly and in a severe state. Pace was slow initially, now it has started galloping. Sensitivity is high. Reaction at the level of mind is high. Vitality is moderate. Immunity is altered. In these two kind of boxes that are evolving, where the pathology is advancing, immunity is getting compromised, and a high sensitivity, this needs frequent repetition in the millisimal scale. I'll go ahead and explain to you how the millisimal scale got evolved and why these candidates are very good for us for millisimal, where you find characteristic mentals and advancing pathologies. If you contrast this with the nitric acid 30 case, that did not give you the constitution totality. That person was so silent, he didn't even want to speak anything. I was just observing and seeing him and trying to pick up symptoms. And the only symptom the relative said was did not want to, has lost all recovery hope. In contrast, see this case. It gives you such characteristic symptoms. How did the patient respond? We started him on 0/1 daily. He started feeling better. His medicines were made OD. He was on steroids for some time and then they tapered it off. Right now, he's only on mesocol. He stopped the steroids on his own. And then you see there is a certain degree of amelioration. Within 2 weeks, there are relapse of symptoms. We had to increase it to 0/3. Then you find that things are getting better. There's again a bout of severe pain and bloody stool, one bout in 22/9. That time we increased it to 0/4. And on 2010, almost all his symptoms got better. And we continued with 0/4 once a week. Medicines continued till December. And when the new office got opened, his anxiety got resurfaced. And we had to go to the next potency of 0/5. Finally, we stabilized him over the next 2 years with SOS doses of 0/6. And then his symptoms settled. He came to terms that all of them are living nearby. His mothers and parents are going to all the three houses, and things are not as bad as what he felt it would be. And everybody's trying to find the foothold in the business that they have put in. So, kind of anxiety got settled. As well as the medicine helped to internally change his sensitivity to what is happening outside, as well as help the pathology, which was advancing. Now, it's very important that I explain to you what is 50 millisimal scale, because this was one of the scales that of late has caught up with all of us as practitioners. So Hahnemann introduced this scale after seeing aggravations and relapsing illnesses. He called it the 50 millisimal. He found that when patients are very sensitive, even with 30 potency, you're getting an aggravation and you're not able to repeat it, and there is a persistent advancing pathology, he started trying the next potency, which was the LM potency. He describes this in his new potencies by the name of infinitesimal. And he repeatedly used it. He wanted to use it once a day, BD, TDS, and go to the next LM2. When LM2 similarly exhausts its potency, he'll go to LM3. And he says usually a patient won't need all the 30 potencies of LM. Within 5 or 6 changing of potencies, you will be able to stabilize your patient much before you reach even LM30. So he found very good results with LM30 in such cases where the sensitivity are high and there is advancing pathology. People like David Little and Shepard have been instrumental in making the last work of Hahnemann more acceptable. So is this part clear of how immunity impacts the posology and how Hahnemann used it to develop the 50 millisimal scale? Is this clear? If there are any doubts, we'll take it after the session. No? Now, there is the last part of suppressions and susceptibility. Now, what happens here? Let me explain this. Suppression is very difficult for us to pick up very easily, but we have to be cautious and we have to be very alert, especially post-COVID. There is paucity of symptoms, absence of expected symptoms, involvement of deeper organs after disappearance of external manifestations. A very interesting case. A child of 7 years lost her mother to a COVID infection during childbirth. The mother was in labor and she was also infected and she was very badly distressed and she died on the table and they could save the baby. But the older child who had come to us, she was in a state of grief She had developed skin eruptions, and some relative took her to some local doctor and treated her with creams. What happened after that? She developed sudden shrieking at night with movements of the hands. She would laugh, start removing her clothes at night, refuse to go to school. Investigations were done because of the shrieking and the movement of hands. They suspected epilepsy. EEG was normal. Shobha, any remedies that are coming up there?
It's natrium.
Pardon?
Natrium.
Natriuria. Just pay attention to the quality and characteristics that are evolving. And just remember, you're teaching a girl who's having two suppressions, emotional grief suppression, as well as a skin that has got suppressed, and she's coming down with an acute conversion disorder, and which is mimicking symptoms of epilepsy, as well as throwing somatic symptoms and motor symptoms. So you're going to be careful when you're going to suddenly start with a deep acting natriumur right now. So just be careful when you have such cases of suppression, and you will have to be cautious in the type of remedy that you use.
The other remedies coming up are Ignatia and Hyoscyamus.
Yeah, hyoscyamus covers more this inappropriate behavior of removing the clothes, which is quite PQRS for this child in her state of agitation. And there's a constant fear that her father and grandmother also will leave her. She's very agitated and restless. And there were two suppressions. Now see, suppressions are going on, plus there are characteristic available. A plant remedy, usually plant remedies respond in the moderate to higher potencies. 200 was given, HS. But what is important in the posology is be very cautious of the repetition. When you have found in a case of suppression, when you find an appropriate similum matching the mind and the characteristics, be careful in your repetition. This is not a structural disorder that needs multiple stimulation. Just wait and watch how the patient is responding. Have patience at least for a month. And this is what happened. The skin came back but went on its own. How do we analyze this? The sensitivity is high, but there is emotional and skin suppressions. Hence, you have to be very cautious, and only in the only infrequent doses will work over here. Even though the vitality is good, and even though there is a functional change. So every case of suppression, be careful in your potency and repetition. Next, we come to the fifth coordinate, vitality and state of pathology. This is a case of coronary artery disease, grade 3 with multiple blocks and impending failure. Now he is 86 years, 82, sorry. He has undergone a open heart surgery 5 years back. Now he does not want anything. Now he does not want any treatment also. He said, whatever happens to me happens. I just want relief from this pain. I want relief from this insomnia. I want relief from this breathlessness. See what he's telling you, all disease symptoms. I have dyspnea, I have angina pain, I have insomnia. And what the report is showing that whatever stents they had used, that is also blocked, and there are multiple new blocks. And there is an impending heart failure that the cardiologist has cautioned about. And he has said take multiple doses of sorbitrate along with his statins, blood thinners, and BP, none of which we have stopped. And all that he wants is relief from pain and dyspnea. How will you approach this case? What is coming up, Shubha? Yeah, okay. I will quickly go through because I think we may run out of time. There are no psychosomatic correlation available. His children are well settled. He doesn't have any problems. He is also settled. He is also, he does not have any issues that are bothering him. His susceptibility, disease symptoms. Pardon?
Sorry to interrupt. There is one this thing they are saying focus on pathology and take a Boger approach.
Absolutely. Take only that approach. Cratagus was chosen only on that approach because we only need to work on relieving his dyspnea, his insomnia. Remember, Cratagus is a very good drug for insomnia. It also helps to dissolve the blocks. And it's going to protect his heart, endothelial layer, and also protect him against severe ischemia. This is a one-sided disease, no psychosomatic correlation. Structural changes are present, vitality is okay, sensitivity, you're not finding anything. He's not telling you any case history also. That's not his concern also. Mother tincture is the right, when we find this kind of an, only the patient is focusing on his pathology and the symptoms are also only of the pathology. You find mother tincture working extremely well to see that we are able to at least stabilize him, to some extent dissolve the clots and maintain his stable state. It's over 6 months now. He has stopped using Sorbitrate daily. He uses it SOS and he's able to walk around, manage himself, manage his house with his, he and his wife stay together. So at least we have kept him up to this level. I have not stopped any other mode of treatment. So what did Hahnemann mention in pathological conditions due to gross pathology or chronic diseases? If the grade of disease is the low, the power of reaction is low, the remedies must be given in low potencies. If the structural changes are reversible, you can use moderate potencies. I'm just revising it again. Case of suppression, we give single dose. In an advancing stage of coronary artery disease, we used mother tinctures. Now, vitality, if it is poor, like in squamous cell carcinoma or the coronary artery disease, Jar mentions that in malignantly rapid fatal disease, susceptibility is so low that it will require material doses. Disease characterized by diminishing activity, topo, collapse, even acute illnesses when you experience collapse, you can consider low potencies. Now we just quickly run through a case of an acute disease. So this is the child who is having frequent attacks of wheeze. And she comes down with this illness since 1 year, chronic hypersensitive airway disease. She has acute spikes on a chronic disease. And it all started, see this characteristic LSMC, cough with rattling, vomiting, worse at night, dull, drowsy. I think all of you will come to Antimtat. The patient was suffering because the father went out of the country for another job. The mother was a very straight lady, like a sepia type. She wasn't very over pampering like the father, but the child missed the father. And that created an intense state of grief. The patient was losing weight, there was brooding and sensitivity. And the chronic totality of the case came to Natrimure. And the acute totality. What is important here? You see, everything is so high, the susceptibility, reactivity, sensitivity, that when you start the case on Antimtat 200 and Natrimure, for some time she was better. Again, it relapsed after 1 month. That is when we had to use 1M. Had we did the analysis correctly, you would have come to Antimtat 1M right in the beginning. But it's okay. Even 200, you can go to 1M as long as you're able to stabilize the patient. And remember that intercurrents, when you're using the potency, whatever is your acute potency matches that of the constitution, it also matches the intercurrent. Now we have people who use millisimal scale. Please ensure you give Tuja also in millisimal scale. This is what I wanted to share here, the learning. Don't change the susceptibility of an individual. When you finalize one potency, it remains for all the disease processes. That's what I wanted to share with you about tuberculinum. Generally, tuberculinum and sulfur go in higher potencies. Psychotic tuja or syphilinum moderate 200. And Hahnemann always feels children have very high susceptibility. So he always doesn't mind using 1M. Now there was the last potency of plusing potency. I do not have so much of experience. I've just started treating a case of diffuse midline glioma of the brain, which is invasive and which has undergone surgery and is on chemo, but the seizures are not stopping. And I'm using plumbum iode. One of my very good colleagues, Dr. Rohina, who also has learned from the Ramakrishna concepts of prescribing has suggested that I go with the plusing potency. I found that Hahnemann in his later years used this potency when he wanted to, when he realized that the sensitivity is high and you can lead to an aggravation. We could have gone to millisymil also frequent in that carcinoma case, but she's still on chemotherapy. She's still not stabilized. I did not want to risk multiple dose of millisymil. I've just kept her on plusing scales of plumbamide 30. That means what? You dissolve the first dose, take out 2 spoons, add another 200 ml, take out 2 spoons from that and add to another 200. Keep on slightly increasing the dynamization of the potency and keep observing if you're getting any aggravations. It's over 2 months now. She doesn't have any seizures and stable. So what do we understand? Susceptibility whispers in the soul. When reactivity takes its toll. Sensitivity feels it's a subtle shift, and immunity stands as nature's gift. Pathology maps the body's plight, yet posology, with doses right, seeks to heal with the smallest means, restoring balance through unseen streams. In homeopathy's tender art lies the key to a healthier mind, body, and soul. Thank you so much to Vishpala ma'am for making us creative in writing these poems, as well as giving an opportunity to share and learn and just be so passionate about our system. To the faculty and editorial board of HGIF, your support and guidance and the way you'll treat each other with respect and so much of care. Really blessed to be a part of your faculty of Bombay ICR and my colleagues at ICR. To Ramdas sir and team MLD MHI Bangalore, and to all my colleagues who shared these cases, who have been working, we have been working in teams on these cases, Mamta, Anita, Sadhvi, Amita, Anjum, Nivedita, Muthulakshmi, thank you so much for all your help in this presentation. And to all our patients who are our best teachers, thank you so much.
Yes, thank you very much, Dr. Latha, for a wonderful, wonderful marathon power-packed session, with almost 10 to 11 cases in such a short period of time. Wonderful. There are few questions, Latha. There is somebody asking, is decimal scale a dynamized medicine or material dose?
It is a dynamized potency.
Yeah. Also, somebody is asking, how do you repeat in the LM potency?
LM
How to give
potency, you start with HS 0 bar 1, then you make 0 bar 1 BD, then you make it TDS. Ideally, it is done in dissolving doses, but we give it, like if I have to give BD, I put one packet in 15 spoons of water and divide it into 2 equal doses. But that is not what Hahnemann had done. He had actually taken it into dilution form and done it, but due to the convenience of our practice and to make it easier on our patients, you start with HS and then go to BD, TDS, that potency gets exhausted, then go to 0 bar 2. Don't jump to 0 bar 2 without exhausting the action of 0 bar 1.
Also, one doctor wanted to know that in the cases of that nitric acid, did you repeat it further, or how did you repeat in case of that cancer?
I have just kept him on 30 TDS because he does not have any symptoms now and he's stable, but the pathology continues to advance. So I don't want to change the potency now. If anything new comes up, if there are any new symptoms that come up of the lung and all, I might have to change from nitric acid to a related remedy to nitric acid like Kalika.
Right. Fantastic. I think no more questions here. Yeah. People have really liked your webinar. They find it very informative and very excellent presentation. You covered up very well, Latha. Starting from all the potencies, there is some question coming. What if some acute conditions comes up during the treatment of chronic case? the acute remedy should be given in LM potency only?
No, I shared a case, right? The patient was 200 natriumur, 200 antimtat. Then it went to natriumur 1 m, antimtat 1 m, tuberculinum 1 m. You cannot change like that. If you're making a mistake, if you're assessing your acute as an LM, then assess your constitution also. It cannot change potencies like that. You have to be careful because your susceptibility is the same. Your body is reacting at the time of chronic to the same potency as what it will react to acute and intercurrent. So it's wrong to use no mother tincture I'll use and then I'll use one scale potency or another biochemical. It'll all have too many different potencies going on.
Right, right.
Yes,
So because
LM potencies work very well in psychiatric cases. Palga psychiatric department had very good cases of LM potencies responding. Yes, if the chronic is also LM, we should use the acute in LM. Yes, you will get faster results.
Can you explain the plussing
And
potency
always keep that box in mind because there are chances the patient will move from LM to centesimal without you becoming consciously aware. So at least after 3 months, put the box in place and see that you're still in LM only. Or the patient's susceptibility has improved and now he needs a centesimal. So keep that box with you every 3 months, review your cases.
Very good suggestion. Latha, can you please explain the plussing method again?
Which one?
Plussing method.
No, plussing scale. What I've just done is I've just started this scale because I'm just learning this from my colleague, Dr. Rohina. And I think when I'm not able to use repeated doses of the LM, because I still don't assess the susceptibility of this child who's having cancer, I would like to be very cautious. Hence, I just take 2 spoons from the first dose, add it to the next 200 ml, give 1 spoon from that, and then I take 2 spoons from that and add it to the third day. Like this is what I'm doing with the plussing.
Okay. Usually we use it in cases of the cancer. Doctor, that is what Dr. Ramakrishnan is doing. He is using it in the cases of cancer when there is a deeper pathology. So I am using it, but using it in a little different way. I think what I have understood from Dr. Ramakrishnan is he takes one dose of the medicine, dissolves it into 10 and dissolve it into 11 spoons of water, stir it and take one spoon every 15 minutes, give 10 doses, let the 11th dose be there. Now dissolve this 11th day, next day, in again another 10 spoons of water and again repeat it one dose every 15 minutes. So finish that thing in 2.5 hours and give that dose repeatedly. Again, let that one dose remain, again dissolve it into another 10 spoons of water. So go on reducing it for 1 week. And after 1 week, again, he gives the cancer nosode or the indicated remedy. So change the remedy in that way. That is how I think I have understood, and that is how I am giving it in a plussing method.
That is a good learning for me too.
Mm-hmm.
And tissue remedies, Vimal, if he demands, please use it. Like I have used in cases of calcaneum spur, I've given only calcarea flow 3x. If the constitution is calcarea flow, I want to use it as a pathological prescription, I just give only 6x. I don't put it with any other medicines. And if I have to use anemia, ferrum phos, 3x or 6x, I give only that. So I don't know how to mix this biochemic with centesimal. I don't know how that concept operates.
Very good. Very good. Yes. Yes, Dr. Latha. I think many questions also you covered it up very well, answered very satisfactorily. I think there are no more questions now, and hope that people have really learned a lot. And they'll keep that your chart is again in mind, which is very helpful to prescribe in the practice. Thinking about taking care of the pathologies, the reversible, irreversible, functional, and then going ahead with all different type of potencies. Wonderful. You covered more than 100 slides in 1 hour. It was a marathon. Fantastic session. Fantastic. Thank you very, very much, Dr. Latha, for this wonderful session.
Thank you. Thank you so much. Thank you, Shobha ma'am, and all the board of IJF. Thank you so much for this opportunity.
Thank you.
Shall we leave the meeting?
Yes, Latha. I think we can leave.